address on COVID-19 and women's health. And finally, as I mentioned, we will have a panel discussion about COVID-19 and ACEs, featuring Dr. Eric Ball from Chalk Children's and Dr. Ann Light from the Orange County Social Services Agency. Next slide. But before I begin the formal program, I do want to review some logistics and then share some thanks and recognitions. So very briefly, in terms of the logistics, all of our summit sessions are going to be recorded, and we will upload the video recordings as well as all the presentation slides on the summit website. And a link to the summit website should appear in your chat box within a few minutes. Which brings me to the next topic, questions. So we have enabled both the chat feature and the Q&A feature this morning. And we would ask that you direct any questions you have for the speakers about the content of their presentation using the Q&A box. But if you have any technical issues and you would like some technical support, then please submit those questions using the chat feature. So content questions, Q&A, and tech support questions, chat. Next slide, please. Like our regular summits that are in person, we of course do have an evaluation survey at the end of today's session, and we would ask that you please complete the evaluation survey because we deeply value your feedback so we can improve these conferences in the future. At the end of the session, you will be automatically directed to an online version of the evaluation survey, so please do complete it at that time. If you are interested in receiving continuing education units or CEUs, they are available for chess, nursing, LMFT, LCSW, LPCC, and LEP. In order to receive your CEUs, at the end of the evaluation survey, you will receive a link to a CEU request form, which you must complete and submit. So just to summarize, please complete your evaluation survey regardless of whether you're seeking CEUs. But if you are seeking CEUs, you must complete the evaluation survey and the CEU request form in order to receive your CEUs. Finally, I wanted to mention that we are excited to share 6 virtual poster presentations covering topics involving women's health in Orange County. And you should see a link in your chat feature to the page on our summit website where these poster presentations can be found. We really want to thank our presenters who have not only adapted a poster to a PowerPoint presentation, but also recorded a narrative that will accompany the poster presentations. So thank you very much and congratulations to all of our poster presenters. Next slide, please. Okay, we'd like to actually talk for a few minutes about who is in the room. So, well, the virtual room. And we've prepared a very quick poll, which should pop up on your screen at this moment. And you'll see 2 questions if you scroll down using your trackpad or your mouse pad. We just would like to know, what do you do? I know many of you have registered, but we're not sure who's actually showing up this morning. And we always like to know who's in the room, so to speak. If you do not work, then please check the community member or volunteer box. And if you do work, then please check whichever description is most appropriate. And then as you scroll down to the second question, we're just curious how you're feeling after several months now of virtual meetings, webinars, Zoom calls, conferences, and so on. So do weigh in so we have a sense of everybody's appetite at this time. Okay, please go ahead and start the poll and we'll start to see the results. Great. Okay, I am actually having trouble seeing the poll results. So what's our winner there, Joe?
So we've got 8% community member or volunteer. Maybe you can just walk over here if you want.
All right, I'm going to step away from the screen for just a moment. but I think you can still hear me. It looks like the majority of you are educators, teachers, professors, or health educators, followed by nonprofit and community-based organization staff. And then a pretty even distribution among the rest of the options here. Some of you work in health systems, hospitals, or community clinics. Some of you are community members and volunteers. We have a handful of lawyers, nurses, a few physicians or physician assistants, and then researchers, social workers, therapists, counselors, and students. Most of you are not exhausted yet by virtual webinars, which is a relief for us to hear. Little less than half are starting to tire, and a few hardcore Zoom gurus are all in. So thank you for indulging us with the poll, and we will proceed now to the next slide. So of course, we have to take a moment to thank our generous sponsors. It has been particularly important this year, and we are deeply grateful for your support as we have had to adapt to this online virtual format. And also the sponsorship has allowed us to provide the summit this year at no charge, which has allowed us to reach a great number more participants. And we are so thrilled to welcome you today. So may I begin by recognizing our lead sponsors, starting with, at the ambassador level, the Arduous Family Foundation. At the champion level, Carrie and Danny Sunshine, Sheila and Egal Sunshine, and the California Wellness Foundation. And at the guardian level, Planned Parenthood of Orange and San Bernardino counties, and the Shaw family. Thank you so much. And I will continue with our remaining sponsors. At the advocate level, Hoag Women's Health Institute, Pamela Gilmore. And at the activist level, Suzanne and Richard Wagner, the Francesca and Giovanna Family Fund, 501c Insight, CalOptima, and Orange County United Way. Many of you have been supporters from the very beginning, and we are most grateful for your partnership and investment in this important work. Thank you. Next slide, please. I also would like to thank and acknowledge the members of our advisory board. We could not do this work alone, and we are so appreciative of your guidance and vision and expertise. So please do take a moment and take note of all of the members of our extraordinary advisory board. Again, many of you have been with us from the start. Thank you. And I would like to also pause and thank and recognize our team. You will be hearing and seeing my colleagues Dina Rubin, Gail Dratch, and Mona Shaw throughout the summit series, but I would like to acknowledge and thank Sydney Minchin, who is working hard behind the scenes to ensure that things run smoothly and has really been responsible for the conversion to this online format. So thank you so much, Sydney, and to the entire team. Next slide, please. So I thought it would be important that we talk a little about why we are focusing our summit on COVID-19 this year. When we originally scheduled this event for an in-person all-day summit, it was themed women's health through the age span, or through the lifespan rather. And of course, we were completely overwhelmed by the COVID-19 pandemic and felt it necessary to change the focus so that we can really explore how COVID-19 is affecting women's health through the lifespan and focus in on several specific health issues where women are being impacted most profoundly by COVID-19. Those being, of course, as we talked about, adverse childhood experiences, sexual health, and mental health. There are many other ways in which women are going to be impacted, especially economically, in the workforce, with caregiving responsibilities. And I am looking forward to hearing our keynote presenter, Judy Belk, touch upon those topics as well. But the reality is that Orange County is experiencing a serious impact by COVID-19. And we're going to just very quickly see what the current state of affairs is. Next slide, please. So to begin, I wanted to highlight that there are numerous resources and websites available where you can find data, information, and links to resources in the community. And I'm just highlighting, because this is a health-themed summit, the Orange County Healthcare Agency's website, which the link is there on the screen for you. There is also a referral line that operates during the week from 8 to 5, and a number of resources can be accessed concerning testing sites, the case counts, what are the current orders from the state and the county regarding public health, planning guidance, mental health support, flyers, and frequently asked questions. I also included a link to the Orange County Health Officer's current orders and recommendations. And we're going to walk for just a minute now through some of the data concerning Orange County case counts and death counts. And fortunately, the county is tracking and reporting these case counts by age, gender, and race and ethnicity. And they are also reporting the case counts by city. There's additional information not broken down, but for the county overall concerning the number of tests, the number of patients who are currently hospitalized, those who are in the ICU, and the numbers that we believe to be recovered. Thank you. Next slide. So as you'll see here on this slide, as of yesterday, Thursday, May 28th, there were 5,744 cases of COVID to date, cumulative, from the very beginning of when we started counting. And of that total, 48% are women and 52% are men, and 0% are unknown. And these figures are pretty consistent with the national trends. We are seeing COVID-19 affect men more disproportionately than women, because women actually constitute a slightly higher than majority percentage of the population in Orange County. So women, we have more women than men in the county, but more men than women are being impacted by coronavirus. We also have seen 142 cumulative deaths through yesterday. And here the disparity is even more pronounced in that 42% of these deaths were women and 58% were male, and a little less than 1% were unknown. So you can see on the pie charts, which are from the Orange County Healthcare Agency's COVID-19 case count page, that that COVID-19 is currently favoring men over women. Next slide, please. I also wanted to just share very briefly that we do see a pretty significant breakdown by race and ethnicity of COVID-19. Again, these statistics and the pie graphs on this slide and the next slide are both current through yesterday. And what's interesting is the dark blue section of the pie graph represents white, Caucasian, and the medium blue represents unknown. And if you add those up together, we have about 46% of white and unknown, which is suggesting that a majority, about 54% of COVID-19 cases in Orange County are affecting communities of color. Next slide, please. I'm taking a look at the death cases, the death counts for Orange County, again, through yesterday, Thursday, February 28th, that we had 142 cumulative deaths. And here, again, we see the racial and ethnic breakdown. What these two pie graphs indicate is that as of today, and this is evolving, the COVID-19 is impacting communities of color, both in the case counts and the death counts, disproportionate to their population percentages. So this is something that is evolving, and the racial and ethnic breakdown within communities of color is also changing on an ongoing basis. So we are tracking this, and we're not surprised to see that communities of color are being most profoundly impacted by COVID-19. This is consistent with what's happening across the country. Thank you. Next slide. So we are very privileged to have some welcome remarks from Congressman Harley Ruda, who is going to talk for a few minutes about what's happening at the federal level with regard to COVID-19. Elected in 2018, Congressman Ruda represents the 48th Congressional District of California. He serves on the Committee on Oversight and Reform, and on that committee, he chairs the Subcommittee on Environment. He also serves on the Committee on Transportation and Infrastructure. During his first year, he is proud to have secured $1.6 million for Orange County families and over $40 million in federal grants for local businesses and public works projects in the district. Unfortunately, Congressman Ruda was called to DC earlier this week, and he is flying back as we speak. Fortunately, he did have a chance to prepare a brief video capturing his remarks. So we're going to cue the video and the sound. Please enjoy.
Hi, I'm Congressman Harley Ruda, and it is a pleasure to be with you today as the OC Women's Health Summit begins. And thanks to you, Allison, and the OC Women's Health Project for your absolutely incredible leadership and for hosting such an important event for our community, even during these extraordinarily difficult times. Women have been fighting on the front lines of this pandemic and are facing unique challenges both at home and in the workplace. 1/3 of essential jobs are held by women. A majority of the social and healthcare workers are women. Women truly are keeping our nation running during the coronavirus crisis. When asked to discuss women's issues, my colleague, Senator Harris, likes to joke and say, "So glad you want to talk about the economy." She's right, especially during the pandemic. Economic policy, worker protections, and paid leave are women's issues. In Congress, I've helped pass 4 bipartisan bills to provide critical economic assistance and bolster our public health response to the ongoing pandemic, including funding for testing and PPE. Most recently, House Democrats passed the HEROES Act, which would provide additional urgent relief to protect the lives and livelihoods of the American people. In addition to my votes in DC, since the start of this crisis, I've been talking to a variety of stakeholders like hospital workers, small business owners, and teachers. I've also hosted panel discussions with experts to increase awareness of the challenges being faced by Orange County families and Americans across the country. One issue that has been exacerbated by the coronavirus crisis is domestic violence. I co-sponsored legislation, including the Bipartisan Domestic Violence Public Health Emergency Guidance Act, which would encourage federal engagement with domestic violence stakeholders and relevant law enforcement to issue guidance and outline best practices and resources to state and local enforcement agencies, with a unique focus on addressing domestic violence effectively while limiting potential exposure to COVID-19. In fact, in the Bipartisan CARES Act, we allocated $45 million for the Family Violence Prevention Services Act and another $2 million for the National Domestic Violence Hotline. Sounds like a lot of money, but the truth is these funds are not enough. Domestic violence and child abuse programs have been historically underfunded, and I'm deeply concerned how insufficient these funds are to meet the challenges that many are currently facing and that many, many more will face in the coming months. We also know there's an increased demand for mental health services. And I've urged House leadership to advance measures that would ensure equal coverages for all health services, including mental health services. Our healthcare workers, a majority, again, of whom are women, are facing trauma head-on. They need mental health coverage and assistance to process and treat that trauma. And we must continue to ensure access to healthcare more broadly. Quality, affordable healthcare should not be out of reach for anyone in Orange County. And let's be clear, this includes sexual and reproductive health care as well, including access to birth control, abortions, and gender-affirming care. I know I don't have to tell all of you, but I'll say it anyways, birth control is health care. We have seen repeated attacks from this administration, even during a global health crisis, to defund community health centers and Planned Parenthood. It's reprehensible to do that at this time. And I will keep fighting to ensure more Americans have access to health care, not less. There's still so much more that the federal government must do to support all Americans during this difficult time. We know so many of these issues, like access to healthcare, equal pay for equal work, and targeted resources for communities most in need, are interconnected in advancing women's health. Frankly, COVID-19 has helped shine a light on long-standing disparities. I want to thank all of you for your work to keep our community safe and healthy. Your work is truly invaluable to families and women across Orange County. And I'll keep standing with you and fighting in Washington and Orange County to address women's issues like paid leave, workplace protections, small business support, and health care. Thank you, and stay safe.
Thank you so much, Congressman Ruda, for those incredible words of support. We are so appreciative that you have been a longtime champion for women's health issues alongside those of the communities and the residents of your district in Orange County. So we appreciate your time and your support. Thank you. It is now my privilege and pleasure to introduce our keynote speaker. Judy Belk is the president and CEO of the California Wellness Foundation. Prior to joining the foundation, she spent about 25 years working in the corporate and philanthropy sectors. She served as vice president of global affairs for Levi Strauss & Company and as senior vice president with Rockefeller Philanthropy Advisors. So I don't usually read verbatim from somebody's printed bio, but I absolutely love what Judy has written about what she does in her role as president of the foundation. She, quote, uses her vision and voice to level the playing field so everyone has access to healthcare, quality education, good jobs, healthy environments, and safe neighborhoods. She writes about these topics and more in a number of publications. You can find her work in the New York Times, the LA Times, the Wall Street Journal, NPR, and others. Judy graduated undergraduate from Northwestern University, and she earned her master's in public administration from Cal State East Bay. Please join me in welcoming Judy Belk.
Good morning. We're just we're trying to get Judy's video online, so bear with us.
Wouldn't be a Zoom without a tech issue. Here we go. Fabulous.
Okay, do you both see and hear me?
We can now see and hear you. Welcome, Judy.
Okay, I'm here. Thank you, Allison.
Thank you.
Thank you so much for the invitation. I really wish I could be in the same space with you all. I was one of the ones who filled out the questionnaire saying, I'm really weary. I'm really tired of connecting with folks through Zoom. So I'm really delighted to be here. I also want to acknowledge the message from Congressman Ruda. We are so appreciative of all the work that he and others are doing for Californians in Washington. I was kind of thinking about what is it that I wanted to share with you. My head is spinning. I'm devastated to wake up this morning to see what's happening in Minneapolis with yet another African-American male tragically life was lost. Concerned about the safety of that community. The milestone of this week of us hitting 100,000 deaths lost by COVID, all of those things are on my mind. So I'm saying, what can I do to inspire myself and inspire so many of you who are working so hard during this difficult time? And I thought I would focus on two things that's on my mind a lot, and I think women a lot. It's really two roles that we play, both in the family and in the workplace. As women, we've always worn multiple hats where we've played key roles. For me, I'm not well mentally if my family isn't well. And COVID-19 has put a lot of pressure on many of us in playing that family role. For parents, it can be a whole new world. I'm fortunate in that my children are young adults. They are thriving. They are healthy and safe, but they're in Washington, D.C. Uh, we Zoom regularly, but I really don't know when I am going to see my children again. And that's really painful. I know that I see many of my coworkers, my colleague Wendy is saying, I don't know how to do fourth grade math. She's doing her job here at Cal Wellness, and she's teaching her son Jaden math. That is the role that many of us are finding ourselves in. There are many folks that are grieving about milestones of graduations and weddings. And for many mothers with young children, many childcare options have disappeared. And many have relied on grandparents as childcare providers, but they're not able to leverage that during this time because we want to keep our grandparents safe. And then many of us are caregivers for our parents or other elders in our families. My aunt Mopsy, who lives in Virginia, she is safe. She's the matriarch of the Belk Casey family, and she's fortunate enough to live in her own home. But we have seen the statistics of how COVID-19 has devastated care facilities. Residents in these facilities represent as much as 40% of deaths, and women are often the caregiver of their parents. And then in the workplace, COVID-19 has changed the lives of women. We've always had to do double shifts, but that's more evident than ever. Many women who are primary income earners for their households are out of work, economic stress, and because in this country, we still link job with healthcare. Not only are many families and women dealing with loss of income, they're also worrying about healthcare for themselves and for their families. Women are also, as the congressman talked about, we are disproportionately represented among the essential workforce, health professions. It's women who disproportionately are bagging our groceries, fulfilling online purchase orders, providing food for our tables through working at meat processing facilities or working as farm workers, all who are putting their lives in jeopardy. And I think that when I think of work, I also think of the work that I'm trying to do. And we at Cal Wellness, we are really privileged. We have a job. Um, we're all working to get resources out to the community. So I want to just talk a little bit about what we have really tried to do in supporting communities and families during this time. Over the last few weeks, we've pushed out about $5 million in emergency rapid response dollars all across the state, including supporting the Rapid Response Fund in Orange County. And I swear, I think 5 million is a lot, but I feel like it's not enough from what we're hearing. We're also trying to use our voice to share accurate information about how to stay safe. We are sending letters and joining with others and really talking about the racial disparities. And we're using our voice in holding government accountable. I believe that the philanthropic community has really responded across California with significant resources, but the dollars that the philanthropic resources have, even if you pulled them all together, are small compared to the trillions of dollars that government has. So we want to be sure that those dollars are getting to the communities that really need it. There are three other areas that I want to talk about. These are issues that Cal Wellness has been focusing on even before COVID, but they've really risen to both our concern and to our focus during this time: place, race, and immigration status. Let's talk a little bit about place. While many of us have been called to shelter at home, and we're fortunate enough to have homes, it's important to acknowledge that for many women, home is not always a safe place. Gun violence prevention, which has been a major part of the legacy of this foundation, has really been a priority. And we've been alarmed by the skyrocketing number of gun sales in recent months. This state has seen about a 72% increase in background checks for gun purchases in March. Um, Calls to domestic violence hotlines have risen in many communities. So violence is a huge issue, and we know that a lot of violence um, happens in the home. And we're concerned about that, and are continuing to look at ways to support communities and families during this time. Where you live is important in this state. There's a huge difference between living in Beverly Hills and living in East Los Angeles. And we're particularly concerned about what happens at the county level, because in this state, the county that you live in can play a huge role if you are a woman or a family needing health care. In Orange County, there's progress that's been made when it's come to expanding access to care, thanks to the work of the Women's Health Project and to other organizations such as the Coalition of the Orange County Community Health Centers, led by our Cal Wellness board member, Isabel Pacera. But there is more to be done to build a robust safety net. Orange County is an important place of our focus. We fund many terrific organizations working on health equity, and more needs to be done. And that's been apparent even before COVID. Race. Allison shared the alarming statistics about the impact of COVID on race. It's been a heavy impact on Black and Brown communities. And these aren't just statistics. I lost my first cousin, Dino, to COVID-19. He put his life at risk to make money as an essential worker, and he died in an Alexandria hospital in my hometown. I've written about this issue, and many of us know that even before COVID, unfortunately, there's a huge gap in this country between life expectancy, depending on your race. The other issue is just the lack of underinvestment in places. And places like South LA and Santa Ana are really struggling as a result of years of underinvestment. And that's playing out as we look at the impact of unemployment and the economy during COVID. Um, we've tried to take some responsibility here in philanthropy. We're leveraging our endowment to get capital into underinvested communities, and we're going to increase that during the next year and a half, where we're really hopefully focusing on getting America and California back to work, but through program related investments and loans, we hope to provide additional resources. Immigration status. Cal Wellness is firm on this. We believe that access to health care is a human right. Unfortunately, we're in a situation where in many parts of even this state, your immigration status impacts whether or not you have access to health care. This is a huge issue for us. It's a huge issue for women. California is home to almost 11 million immigrants. Of those, about 23% are undocumented. I am proud that our state has taken some action to provide cash assistance during this time to undocumented immigrants, but that's not enough. The fact that the federal government continues to block access based on immigration status is unconscionable during this time. Okay, so there's a lot that I've thrown at you, and you could want to say, I just want to go back to bed, Belk. But what can we do? I think each of us, we need to be intentional in how we engage in recovering and rebuilding in the post-COVID world. Think about the hats that we all wear, the tables where we sit, the anger that we have. Sometimes anger, if channeled in a positive way, can spur action. Anger can sometimes be good. We need to be angry about injustice that is so apparent during the COVID pandemic. We need to hold government accountable. We can't just rebuild the same systems that have left so many women in California vulnerable. We need more resources. Starting with, you can vote, not just determine who lives in the White House. It matters who serves on the Orange County Board of Supervisors, local school boards, and who represents us in Sacramento. We can champion the importance of investing in women's health in the state and in the national level. We're concerned about the recent budget revision that we've seen at the state level, reducing funding for many programs that women depend on. We're looking to our advocacy partners like the Orange County Women's Health Project for help. We need them more than ever. And at the national level, as the congressman said, women's reproductive rights are under threat. This is not a joke, in ways we haven't seen in decades, at risk because of the current administration policies, including changes in Title 10 and the potential reversal of Roe versus Wade. I can also tell you that Cal Wellness will stand with you on these issues. Together, we need to rethink what the safety net should look like. Maybe we can finally have a conversation in this country about delinking jobs and healthcare like the rest of the world seems to address. We need to maintain a focus on reducing income equality, a key social determinant of health, and we need to keep a focus on race and place central to our work. We at Cal Wellness, we're going to use all of our tools, not just our grant making, our voice, our investment dollars, to support communities across California. I, again, want to just end by saying I really wish that we were all together. The line of the speakers and the panelists are unbelievable. And I know they're going to address a number of issues that we care deeply about trauma, ACEs. And in closing, I just want to say self-care is my most important message that I want to leave you with. For you and your families, for your workplace, many of you are on the front lines working in clinics or healthcare facilities or at nonprofits that are providing critical services under the most challenging conditions. While I hope this crisis will pass soon, this is a marathon, not a sprint. We're going to need your leadership. We're going to need your vision. And at times we're going to need your anger for the rebuilding that's to come. I hope that we'll have some time to engage in conversations. And Allison, I want to turn it back over to you and thank you again for inviting me.
Wow. Judy, I have to agree. I so wish that we were in person together right now, because I'm quite confident that the room would be full and people would be on their feet, standing and giving you a full standing ovation. I cannot agree with you more about calling out the inequities that have been exposed during this crisis and the importance of rectifying those inequities in the rebuilding from this crisis. And I'm thrilled to hear that the California Wellness Foundation has been so proactive in pushing funds out to support the crisis response, and already looking forward to not only funding, but informing what the recovery should look like so that we can achieve more effective, efficient, and equitable systems of care. I would like to ask if you could take a moment just to share some thoughts on how the $5 million has been deployed. Have you noticed any particular trends? I know locally in Orange County, our Orange County Community Resilience Fund has focused pretty heavily on basic needs delivery, food, shelter, and healthcare. And our United Way Pandemic Fund has been supportive of housing and the basic needs of individuals and families. So we are so grateful for your support and for the leadership of all the foundations and funders that have contributed, as well as individual donors, to these two county-wide funds. What are you seeing from the California Wellness Foundation's perspective?
Sure. Well, the one thing that I love about Cal Wellness, which is just part of our tradition before I even joined, is that we're what's called a responsive grant maker, which means that we really take our cues from what's happening in the community. So as soon as the COVID response happened, our programs team got on the phone and just reached out to our community partners and saying, what's happening, what's going on, what can we do? And not surprisingly, they said, get us some immediate rapid response grants as soon as possible. We're just needing resources. The other group that we really touch bases with are our community foundation partners in Orange County and around the state. The one thing that you realize in a situation like this is a big state. And the needs that are in Orange County might be very different regarding what the needs are in Imperial Valley. We are a statewide funder, so we really thought, all right, how can we respond? So the first thing we did is that we immediately just start sending out rapid response grants to all of as many of our key grantees as we could. We sent rapid response grants to all of the regional associations of community clinics, such as the one Isabel leads in Orange County, because they were at the front line of the effort. But we also relied on our community foundations, who immediately put together rapid response funds. And we really felt that community foundations, of which California is really so fortunate, and Shelley's work in Orange County is a great example too. They are really close. We felt getting dollars to them that they could then funnel immediately to food banks, to domestic violence shelters, to deal with the homeless issues. So those dollars got out fairly quickly, and we really felt that with the support of these regional emergency funds, and with our own rapid response, where we got out about 5 million. I just looked at the stats that we really did touch every corner of the state. But as I said, to me, that's pennies. We really then decided to work with other funders, and using our voice, and really saying, we funded a lot of advocacy organizations that are putting pressure on Washington, that as these trillions of dollars are coming down, are they hitting? And I would say the first wave didn't quite hit the communities that we wanted to be hit. A lot of businesses of color and other depressed communities were not getting those dollars. So we also kind of reached in with that, and we're continuing to work. We also began to make a few program-related investments and loans, and we've just continued to talk and talk. And it was really the community who were the first who hinted, "Hey, this is hitting several communities disproportionately." When we were talking to our folks in South LA, they were the folks who saying we're seeing a disproportionate hit on communities of color.
Thank you. You mentioned that you were funding advocacy organizations, and actually this touches on some of the questions that are coming in from the audience. So Sora Tanjasiri asks, what do you see as some of the major policy opportunities that can address both COVID-19 and health equity, including justice?
Wow, I've been thinking a lot about that, because I really mean it. If we go through all of this, if all of these lives have been lost, and we come out at the other end with the same broken systems, I think I'll just go nuts. So this is what's on my list. Number one, can we really begin to have a serious conversation about universal health care? Really, my friends in Europe have thought, even before COVID, that we were nuts in this country, where the best shot you have of having health care is to have a job. And they're saying, well, what does having a job and having healthcare? So if you don't have a job, you don't have healthcare. Well, here we are, right? So that's an issue. Income inequality. Can we really begin to really look at income equality? Believe me, I hate that anyone is on unemployment, but and your folks know that income inequality has been an issue for a significant part of women and folks in this state for many years. And so maybe there could be a little compassion for those who have found themselves standing in food lines and counting on government to provide support, that when they find themselves back at a job, that maybe they might have more compassion to look. So that's an issue. The issue about race, we've talked about that. The fact that there's almost, an 11 years life expectancy difference between a Black male and whites is crazy. So maybe we can look at that. I think we'll need to look at the issue of equality around digital divide. Most painful story I heard was amazing honor roll students across the country trying to do their homework on their cell phone. And so I could go on, but those are a few. And then I think really a new social compact with government. Do we really need to have an argument about whether or not we should look at government and helping to provide a safety net? Maybe there'll be more compassion when so many folks who never thought they would ever have to look to government for support can understand why that has been a norm for so many in this country.
Thank you. I do think that is one of the challenges, certainly, but also potential silver linings is that so many people who have never had to navigate a public benefit or a public program are going to learn just how difficult that can be, especially when our infrastructure is already being so overtaxed. So thank you for calling out some of these policy opportunities. We have time for one more question. And I would ask from Felicity Figueroa, has there been any funding specifically from Cal Wellness for the undocumented community? Do you know whether any of your emergency crisis response funds have supported?
Sure. We're really quite proud, even before COVID. I took this job in 2014. I thought, this is so exciting. The Affordable Care Act, Obama's in office. And we decided at that point that we were going to really focus on those who were left behind. So even the Affordable Care Act left behind, in our mind, on the undocumented community. So we were always zeroing in our effort on that. We have a report just came out by a watchdog group of the philanthropic organization, the National Center on Responsive Philanthropy, and they ranked California Wellness Foundation as one of the leading funders in California for immigrant and refugee support. And we have, I know that there are many other foundation partners across the state that join us, but we are zeroing in on that. We don't think that because you live in LA County, you have access as an undocumented to healthcare, and places such as Orange County and others that you don't. We believe it's a human right, and the fact of your immigration status shouldn't matter one bit.
Well, thank you so much for your incredibly inspiring remarks, your insightful exploration of how this pandemic is affecting women's health and communities of color and those members of our community who have been left behind historically. This has been an unbelievable way to kick off the series. Thank you so much, Judy, for your time and your expertise. And we look forward to your continued partnership in Orange County.
And Allison, thank you so much. And again, I want to just provide gratitude to you, to your leadership, and those of you in the audience. Please, we want to hear from you. Send me a note. Follow us on Twitter. We'd love to hear your thoughts. And I know you're going to have just an amazing summit. So thanks for letting me kick it off.
Thank you. I also want to thank you for sharing your personal story and how you've been affected by this pandemic and to acknowledge that we did reach this very devastating milestone of over 100,000 deaths this week as a country. We are all mourning, and I think we should all heed your call to action to make sure that we parlay our anger and our sadness into action. And on the note that you just mentioned that the foundation would like to hear from everyone in the audience, I'd also like to echo that and say we are just as interested. And in the evaluation survey, which I'm going to plug throughout the morning, we actually have added a few questions. You'll recognize most of them from past summits, but we would really appreciate your comments and suggestions on what else we can be doing and what else you'd like to be hearing and talking about after the summit with regard to COVID-19, and especially looking forward towards the rebuilding. We have to inform the process in Orange County and beyond. How do we overcome some of the structural barriers and the institutionalized disparities as we have this once in a lifetime opportunity to rebuild our systems of care in Orange County? So please do take time and share your thoughts with us, and also send them to the California Wellness Foundation. So thank you, Judy.
Thank you so much.
Okay, we are now going to move on to our panel, and I am so excited to get to introduce my colleague and friend, Dina Rubin, who will be moderating this panel on adverse childhood experiences, otherwise known as ACEs, and how the effort to screen for ACEs in the state is being impacted by COVID-19, and how COVID-19 is actually interplaying with the stresses that can contribute to or exacerbate adverse childhood experiences. Dina is the program manager for the Orange County Women's Health Project. She has over 30 years of experience developing and managing preventive health and human services programs throughout California. Prior to joining the Orange County Women's Health Project, her work in Orange County focused on child abuse prevention. Dina consulted with the Orangewood Children's Foundation and the Social Services Agency to develop the FACT program, that's Families and Communities Together, which is a county-wide network that supports the family resource centers in Orange County. Dina also helped to coordinate the county's comprehensive child abuse prevention plan for a number of years. Dina earned her master's in public health at UCLA, and it is a pleasure to welcome you, Dina, to moderate our panel. Thank you.
Thank you, Allison. I appreciate the opportunity to moderate this next panel of experts on the topic of COVID-19 and adverse childhood experiences, otherwise known as ACEs. I'm sure we are all concerned about how the pandemic and the associated stressors are impacting children, thus possibly evoking ACEs that can have long-lasting impacts. During this next panel, you're going to have an opportunity to hear from two experts in the pediatric and trauma fields about how ACEs can impact short and long-term health conditions in girls and women, as well as how COVID-19 is impacting children and possibly leading to ACEs, as well as what is being done collectively at the local level, as well as throughout the state, to screen for, address, and refer for ACEs, and how we are adapting to the COVID-19 world, specifically with respect to self-care and developing resiliency. And now it is my pleasure to introduce our next two speakers. Our first speaker, Dr. Ann Light, is the medical director for the County of Orange Social Services Agency. Dr. Light is a pediatrician specializing in childhood trauma. She earned her medical degree from Harvard Medical School and completed her residency training in pediatrics at Massachusetts General Hospital with a focus in trauma and emergency care. Prior to 2015, she worked as a pediatric provider within the Massachusetts General's Partner System and served as the executive director of a nonprofit to optimize early learning in children aged 0 to 3. She joined Orange County Social Services Agency in 2015 and is working to create an interdisciplinary program to support children and families. She is currently leading and developing the We Can Coalition, which stands for Working to End Child Abuse and Neglect. Our second speaker is Dr. Eric Ball, a pediatrician with Chalk Children's Primary Care Network and immediate past president of the American Academy of Pediatrics of Orange County. Dr. Ball is a member of the Board of Directors of the American Academy of Pediatrics California, and he serves as an assistant medical director with Chalk Health Alliance and is a delegate to the California Medical Association House of Delegates. He currently represents the American Academy of Pediatrics on the California Surgeon General's Trauma-Informed Primary Care Implementation Advisory Committee and is helping to implement ACEs screening into primary care settings. Dr. Ball attended medical school at the University of North Carolina at Chapel Hill and trained in pediatrics at Stanford University, where he also served as chief resident. Before Dr. Light begins, I just wanted to provide a quick reminder that we will be holding all questions until after both presentations, and any questions should be placed in the Q&A feature of Zoom. Now I would like to invite Dr. Light to deliver her presentation, and then she will hand the webinar over to Dr. Ball. Thank you.
Thank you so much, Dina. It's such a pleasure to be here today. For those of you who haven't met, my name is Dr. Ann Light. I am the medical director of the Orange County Social Services Agency, and I'm thrilled to be here today to talk to you a little bit about ACEs, as well as how they're intersecting with women's health and with COVID-19. Next slide. Wonderful. Oh, so quickly, financial disclosures. I am an employee of the County of Orange. I'm so lucky that I actually get paid to promote awareness of social issues and try to support children and families that are struggling. I don't have any other financial disclosures. Next slide. So if you could go ahead and click one more time. These two pie charts are really the reason that I ended up where I am. I actually started off in genetic engineering before I went to med school. I worked there in the late 90s and really was one of those people who was gung-ho about how genes are going to impact biology. But the more I looked at the data, the more I became convinced of what so many of you probably already know and had to teach me, and that is how much social and economic factors really are the basis for health in America. It turns out that about 70% roughly of actual genetic changes are going to be due to social, environmental, and economic determinants, and way more than that. So on the order of about 80% is going to be 80% of the financial impact of health in this country is again going to be driven by social and economic factors. Next slide. So there are many ways that happens. There are a lot of different pieces of our environment that will interact with our genetics, but one of the most powerful is adverse childhood events, or ACEs, and that's really what we're here to talk about today. So quickly, these ACEs that you see on the slide in front of you are the ones that were originally in the studies to prove long-term health outcomes. You will see on many ACE screeners there have been new additional ACEs added in, but these are sort of the crux. It really boils down to abuse and neglect of children as the most impressive common denominator. So you can have physical abuse, emotional abuse, sexual abuse, physical or emotional neglect, and then severe household dysfunction. So severe mental illness, violence in the home, substance abuse, and often in practice, we're going to see those things interacting with physical abuse or neglect of the children at the same time. Next slide. So why are these ACEs so important? So these adverse childhood events were actually found to be critically important in the lifelong health of individuals. And that's true for all races, all genders, and in fact, all across the world. So what we see is when you have more of these adverse childhood events, particularly again, child abuse or neglect, you end up seeing changes in behavior and you end up seeing changes in health outcomes. So everything from obesity and diabetes to heart disease and cancer and stroke, things that we wouldn't necessarily think would be obviously linked to childhood trauma. Next slide. And what you see on the slide on the right in the graph is just representing there's actually a dose-response relationship. So depending on the number of ACEs you have, and also the duration and the severity of those ACEs, you are going to have dramatic changes in a host of life factors. Everything from the health issues we talked about, obesity, diabetes, depression, suicide attempts, through behaviors like smoking, alcoholism, drug use, sexual behavior, all the way through to what we call life potential. So graduation rates, academic achievement, time lost from work, and all it together. Once you get 6 or more ACEs, it actually changes your life expectancy. It shortens the little telomeres on the end of your chromosomes. That's like the alarm clock for how long that cell is going to last. And so it actually changes your genetics. What we see is a life expectancy 20 years less when you have 6 or more ACEs. And what that means practically is the average in the US is about 79. As Judy pointed out, there's huge variation in race and in sex, as well as in economic standing, but average about 79. Once you have 6 or more ACEs, your average life expectancy is going to drop to about 59. To put that in context, people in the Democratic Republic of the Congo have a life expectancy of 60 years. So the children in our communities that are struggling, that are experiencing large levels of abuse, neglect, and household dysfunction, those children have very poor life outcomes unless we intervene in this system. Next slide. In fact, again, this is another slide that sort of shows how I ended up interested in this work and why I think ACEs are so critical. This slide really is looking at some of the major issues that affect health, including women's health, but more broadly, health across our nation and our state today. And it looks at, well, if we could address ACEs in all of the children that are in Orange County today, what would our population look like one generation out? How much could we reduce things like alcoholism, like mental illness, like cardiovascular disease, like HIV? And what you see is if we could ameliorate or decrease ACEs, you would have huge decreases in a lot of the most common illnesses in our population. So serious mental health conditions, moderate to severe, meaning you miss more than 14 days of work or activity, would decrease by more than 60% if we could ameliorate ACEs. Cancer and heart disease would go down by about a quarter, alcoholism by about a fifth, high-risk HIV down by almost 60%, and so on. And in fact, there are many that aren't on this chart, but again, it's not just about helping the children have a good childhood. It's about setting our society up for good health outcomes. And particularly when we're looking at things like racial disparities and economic disparities in health outcomes, some of that is how we medically treat them. But a lot of it goes back to that pie chart I showed in the beginning. And that when these children are growing up in homes with high ACE levels, we're actually altering their genetics, we're altering their biology to set them up for poor health outcomes in the long term. And really, the opportunity to intervene is when they're young, not when they're older. Next slide, please. All right, so how do adverse childhood experiences work? You know, when I was in medical school back in the last millennium, isn't that funny? I love saying that. Makes me feel even older than I am. So back in the last millennium, what we thought was that you had these horrible experiences, you had a really rough, potentially social situation in childhood. As a result, you didn't know how to make good choices. Yeah, you made bad choices and you had bad health outcomes. It turns out that's completely incorrect. It turns out that adverse childhood events actually disrupt your neurodevelopment. So it changes the way your brain grows. And it's that change in the way your brain grows that leads to some of the health risk behaviors and some of the bad outcomes. And in fact, there have been really good studies done recently that show that even when you make all the right external choices, your risk for cancer and autoimmune disease is still astronomically higher if you've had those adverse childhood experiences just biologically because of the way your brain has been built. And we're going to look at that in a second. Next slide, please. So brain development depends on use. Again, back in the last millennium, in the dark ages when I trained, I was taught that, you know, you're born with a tiny little seed of a brain. It gets bigger and bigger and bigger till you're about 25. And then it sits there and just kind of shrivels away till you die, right? That's it. You get it, you grow it, and you lose it. And in fact, that's not true at all. The brain is constantly growing. It's constantly generating new stem cells and new capabilities. Its size, its shape, its pathways are changing. And it actually grows to be what you need. And so early experiences are really powerful because if there's a lot of trauma in your life, your brain tries to become very reactive. It thinks, oh, there are a lot of tigers chasing me. I better be a good fighter. That's what I'm going to need to survive. When you grow up in a very stable environment, you tend to have more a more biologically neutral brain, which is very adaptive in a calm environment. And so what we see is that children who grew up in these very chaotic or difficult situations when they are early actually changes their brain biochemistry. Next slide, please. So I'm going to talk in the next few slides about child maltreatment. I'm talking about that as a model for all ACEs. And the reason it's a model for ACEs, one, it's one of the most powerful ACEs that we know of. It's one of the most impactful. But more importantly, it's something we've studied really closely. So as you can imagine, in the social services agency, if we receive a report that a child has been, for example, sexually abused, we don't just say, oh yeah, that sounds right, or oh no, probably not. We do forensic examinations with the child, with the family. We have psychologists who interview and play with the child extensively. We do medical examinations, we do testing, and we try to get a sense from the entire family of, is this a credible threat to the child? Because there are huge consequences of believing there is abuse where none exists, right? And there's also huge consequences of missing abuse to a child and leaving them in a situation which is very dangerous. So when children are maltreated, we are very careful to get all the data, and it makes it really easy to look at outcomes of people who were maltreated and who were not maltreated and how their brains are different. So the next couple slides, again, are going to be about maltreatment and maltreated brains, but it's really a rubric for all of adverse childhood events. We think they all work the same way, not just in humans, but in mouse models and other models. So really what happens, if you guys all put your hand up, and I know you're at home so you can't see me, but please put your hand up, put your fist up, your right hand up, and curl your thumb underneath your fingers. There's no punching, this is a nonviolent discussion. Put your thumb inside your fingers. And now imagine that thumb is going to be the amygdala, the deep brain that controls reactivity and anger. And the fingers on top are going to be the fingers that control your higher cortical function. So when you really think about how you talk and use language, when you think about how you solve problems, when you think about how you pause to make a decision, okay? And when you think about your social capabilities, those are all on the top there. And what happens in maltreatment or in severe ACEs is that thumb grows very, very big, and the fingers start to get spindly and spread out, okay? So if you remember one thing from this talk, remember that maltreatment and ACEs are gonna grow that thumb, and they're going to decrease those higher level capabilities. And if you click 2 steps through the slide here, you'll see some visuals on what those really look like. So the angry raccoon in Elf, I have a daughter, so we watch a lot of kids movies. The angry raccoon in Elf is that immediate reactivity. Someone's coming my way, I'm gonna freak out and respond. And again, this is an adaptive response. If you're a 3-year-old and you're beaten, right, when dad comes home drunk, it's actually very adaptive to run and hide and to fight back when you need to, because it keeps you physically safe, okay? But that reactivity will persist throughout your lifespan. On the opposite hand, if you could click again, those higher level cortical functions are sort of Professor Xavier in the X-Men, so very calm, very collected, very paused. And again, this is biological. You can map this out to brain regions. Next slide. All right, so this is to show you guys, this is not subtle, right? So what I'm talking about here, it sounds very, very detailed, but it's very clear what's going on. So on the left hand side of your screen, you'll see a healthy brain, a normal brain. On the right, it says abused brain. This is actually from a Romanian orphan who was neglected as well as abused. And it turns out severe neglect, you'll look exactly the same, okay? So there was no head trauma to this child. What you're looking at is that the black areas, there's essentially no brain. And in the red areas, there's active brain that's healthy and that is processing and using sugar. That's what they're actually measuring, sugar uptake. So on the left, you'll see a couple black areas. Those are actually like a circulation system for the brain called the ventricles that circulates cerebrospinal fluid to make sure that the brain stays healthy. So those are normal. But what you see on the right is huge areas of missing brain. Now, whether it's physically missing or whether it's actually not activated, right? So it's functionally empty because there are very few neurons per unit of space and they're not really interconnected is debatable. But in terms of the functionality of the brain, you're missing huge areas. And remember, the brain isn't magic, it's not Wi-Fi. So neurons need to be connected to each other to talk to each other, okay? And so when you see the brain on the left, everything's interwoven. It's easy to process information back and forth. The brain on the right, there are huge areas of disconnection that are going to make it virtually impossible for that frontal cortex who's trying to think to access and calm down that angry little raccoon in the back of the brain, right? Professor Xavier has no chance of calming down the raccoon if he can't bridge that chasm in between brain areas. Next slide, please. Click through a whole bunch of times. I think you've seen these before. So what we're looking at here is normal neurons, 2 or 3 more clicks, please, versus neurons under chronic stress. And what we're seeing is on the top there, keep going, one more. Thank you. So what you're seeing on the top there is a normal neuron. And in the slide on the left, we're looking at the neuron as the circle in the middle, and all of the lines coming in are additional neurons that connect to it. Again, the connectivity of neurons is what's going to determine the capability of the brain to process information. What you're seeing on the right-hand side on the top is actually the axon of the neuron in profile, and all the little things coming into the side are other neurons connecting to it. What you see on the bottom is a neuron that is under chronic stress. And so again, you're seeing on the left, the circle, and you'll notice there are way fewer connections coming in. And some of the ones that are there are actually starting to die and retreat, particularly that green and blue. They're starting to get farther and farther away from the original neuron. And similarly, when you're looking at the longitudinal view of that axon, you're seeing fewer and fewer connections coming in, and some of them appear to be breaking down. So what this is showing is biologically, your neurons are dying, okay? Under chronic stress, the neurons are dying, and they're dying predominantly, again, in that prefrontal cortex, the front here, and somewhat in the hippocampus, which is the region of memory. And this, just as an aside, becomes particularly important in cases of intimate partner violence or other kinds of violence, when you'll have victims not really being able to give a convincing, reproducible story of what happened. And that's because their neurons actually die. The neurons that encode that memory die at the time of stress. And so it becomes very difficult for them to actually know what happened, which leads to some of the behavior that can be seen as prevarication by people who are not informed as to the biology of this stress. Next slide, please. All right, click through till we get slides all the way up to 7. When I do this, sometimes I ask people for a pop quiz, but I know you're all at home, so I will let you hang out. What amazes me about this slide is I'm a trained pediatrician, and when I do give this talk and make people guess, I say, well, how many, if I had 1,000 children, or 100 children, how many of them do you think I could look at and spend an hour with and say, definitely they've had some serious ACEs, I can tell by the way they're processing, by the way their brain is processing. And people usually guess 50, maybe 80%, but the truth is closer to 99.8%. So once you get to 7 ACEs or more, only 2 children in 1,000 will not have significant neurodevelopmental delay. Now, that doesn't mean they can't come back, right? We have programs for all children under 5 in our agency where we screen them immediately upon entry to our system. We link them to extra services. We help with them with whatever they need, often speech and language, but really any cognitive deficit will start to remedy. So they can have wonderful outcomes. I'll tell you my ACE score, I'm on the right, I'm at the 7 for all of these ACEs, and I'm doing okay, right? So I don't have any severe neurologic deficits left, but your brain does change very dramatically in cases of early trauma. And so we need to be aware of that, and we need to start thinking about how we can ameliorate that so these kids can have good outcomes. Next slide, please. All right, this slide has 2 things going on, and I'm going to ask you to look at one now and save one for later. So what I want you to look at right now is that left to right, as the ACE score goes up, chronic depression is going to go up as well. And this holds true through 5 and 6. You will notice there is a female-male differential, which I'm sure everyone's getting all excited about, as I am. I'm actually going to come back to that part of the slide. It's going to make its way into the presentation a little later. So for right now, just think about that upward trend of ACEs and how they're going to interact with depression. Next slide, please. This is just a different way to look at one of the same issues. This is a prescription rate. So depending on the number of ACEs, what are the odds that you're going to need a psychiatric or antidepressant prescription at some point in your life? And you see it really starts to increase pretty dramatically as you get to 4 or 5 ACEs. Next slide, please. And what's really depressing, I think, is that not only are you more likely to need some medication or treatment, but it's unlikely to help you as much. So what we find is that if you were traumatized as a child, and again, this data is specifically for maltreatment because it is easier to measure statistically and do large scale population studies where you're drawing data because we have databases that contain this information. We find that you're 3 times less likely to respond to medication or psychotherapy. And so particularly when we're working with adults who have been traumatized as children, it's really important to know that history because it affects your biology. So there are certain medications, I think Celexa is one, for which if you have no history of childhood trauma and you are struggling with anxiety or depression, there's an 85% chance the medication will work for you and a 15% chance it won't. If you experience childhood trauma, even if your current stressor is loss of a job, right? Quarantining during COVID and trying to manage your 5 children, whatever the current stress is, if you had childhood trauma, your brain is wired differently. And so now the Celexa, there's an 85% chance it will not work for you. It won't help at all. And only a 15% chance that it will. So understanding that biology, again, is so critical. It's one of the reasons, again, that you're 3 times less likely to respond to treatment for mental illness. And once the treatment stops, many people will have a stable state and then over time return to a depressed state or an anxious state. And that happens 3 times faster if you've been maltreated as a child. Next slide, please. All of which leads to this horrifying graph that keeps me up at night. That is to say, when children get to 7 or more ACEs, there's more than a 35% chance they will attempt suicide in their life. So of the 2,500 kids I have right now, the average ACE score is probably 6 or 7, actually probably higher if you include some of the ancillary ACEs. So I know that 800 of those kids are going to attempt suicide. I don't know which 800, and making sure that they get the help they need is honestly what keeps me up at night and keeps me going every day. Next slide, please. All right, so I want to talk about ACEs in women's health. And we're going to talk about 3 different levels of interplay. So the first is differential exposure to trauma over the lifespan. The second is going to be differential susceptibility to certain illnesses and how ACEs are going to change your susceptibility to those illnesses. And the last is just reiterating the ACE contribution to almost all women's health issues. All right, so I apologize, I cannot see all of the slide the way it's laid out on my end, but really what I want to get at for the second bullet is that there may be some ACEs that women are more likely to experience. So we think within the United States that sexual abuse and intimate partner violence is more likely to happen to women than to men. What was interesting when I started digging a little bit is I love data. So I was thinking, I'm going to get data to put up here. And what I found actually is that there's huge variability in the reporting of ACEs. So in some communities, you will see that ACEs for women are very high and men are very low. That can be really different in other communities. And it's really different across the world. So I was shocked when I was looking at some studies out of the Middle East and Africa that showed that in those communities, men were astronomically more likely to report sexual abuse. Now, is that as compared to women, not as compared to men in the United States? And so is that because there's more violence against men in those communities? Is that because there's more shame against women reporting violence? What's going on is really hard to tell. So again, anecdotally, I feel like we see a lot more violence to young girls, but the data doesn't necessarily capture it, nor is the data inclusive, because for me to know about trauma to a young girl, I have to hear about it from someone. And there are good studies showing that young girls are more likely to confide in other young girls and teachers who would then call the problem to our attention. So plus minus, women may be experiencing more ACEs, but I think that's a hypothesis that I can't necessarily bear out by data. Next slide, please. Thank you. What we can say is that women are more likely to experience specific health issues such as depression and anxiety after ACE exposure. So what you're seeing here is that women are more likely to experience anxiety or depression than men at baseline, okay, no matter what. But what happens with ACEs is that the curve starts to go up. And in fact, you start to get more anxiety and depression the more ACEs you have. And what you see on the slide is that the curve for men goes up kind of like this, and the curve for women goes up kind of like that. And so by the time you get to, for example, particularly 5 or 6 ACEs, which isn't covered in the slide, the discrepancy between anxiety and depression in men and women has gone from 5 or 6% to 30% difference in anxiety and depression once you have all of those ACEs, right? So the final outcome is very gendered. And that's both a product of ACEs and it's a product probably of innate biologic susceptibility to some of those health issues. Next slide, please. Definitely want to, again, talk about, last but definitely not least, the fact that ACEs are going to contribute to really all women's health issues. So when you look at things like breast cancer, cervical cancer, lung cancer, right, all of those things are going to go down by a quarter, or in fact, in the case of breast cancer, cervical cancer, probably much more than a quarter, if we could get a handle on early ACEs. So early ACEs are going to have a big impact on sexual behavior, which I think we had in an earlier slide, but I perhaps didn't elucidate very clearly. So sexual behavior is dramatically impacted by ACEs. You're much more likely to get STDs. You're much more likely to struggle with an unwanted or unplanned pregnancy when the ACE score gets higher. And similarly, it's going to have a huge impact on things like HPV status and therefore cervical cancer. In addition, again, all of baseline women's health is going to be impacted. And we'll see things from HIV, high risk, all the way through cardiovascular health. Next slide. All right, so we're going to take a abrupt right turn here and really talk about a little bit about ACEs and COVID-19. So I want to be really clear. COVID-19 is stressful for everybody, and everybody's stressed in a different way. So there are huge numbers of stressors right now, and I do not want to downplay that. But I also want to be really clear that stress is not an adverse childhood event, right? So adverse childhood events are really abuse, neglect, or very deep-seated household dysfunction, okay? Not mild depression, but severe interactional problems within the family. And so stress is not an adverse childhood event. That said, COVID may lead to more ACEs. Next slide. So we don't have discrete data. We're not collecting in real time as much data on what COVID's going to do to our population because it is so early. Maybe Eric will be able to prove me wrong. Eric, if you can, I'd love that. But so far, I haven't seen much data on how COVID may really be impacting ACEs. That said, I do have a lot of concerns. I will tell you our hotline for child abuse and neglect, as well as elder abuse and neglect, we're getting about half the calls that we usually get because kids are at home. They're not out and about in the world where people can see them and interact with them. And yet, despite this decrease in calls, or perhaps because of it, we are seeing anecdotally increases in the amount of severe head trauma, severe fractures, really violent bone breaks, and other severe maltreatment of children as they come through the emergency room. So stressed families can really struggle, and anything that increases stress, particularly financial stress, can have an impact on ACEs. It turns out actually one of the best ways to prevent child abuse is to raise the minimum wage. And one of the biggest predictors of child abuse is to have a home that's going through foreclosure. That can actually dramatically increase the likelihood of physical abuse in the family. So it's very, very likely that a lot of these ACEs, particularly physical abuse and neglect and mental illness and substance use of parents, are going to be going up in the context of COVID. Next slide. So this is a slide where I'm really looking at in Orange County for our families that are struggling with abuse and neglect. So there may be plenty of families who are struggling with substance abuse, incarceration that are not on our radar, but for those who are on our radar, I think the common belief is, bad people hit their children. Well, it turns out it's much more complex than fact. In fact, about 2/3 of our cases, the biggest issues are substance abuse, mental illness, or intimate partner violence, with substance abuse alone being more than 1/3 of the cases, and that really being the root cause of the family dysfunction and the neglect. Here in Orange County, before COVID, we could safely say about 80% of the children coming into our system were due to neglect. So it wasn't necessarily people who were sexually abusing their children or someone else's child. It was really people who were struggling so desperately with substance use and mental illness that they were not able to care for their children, right? That they were pulled over because they were walking down the 5 at 3 in the morning, disheveled, and with a 2-year-old kind of running in and out of the lanes of traffic, right? So very unsafe household, but not malicious, really, really, really struggling with mental illness and with substance abuse. And again, all the data that we have around quarantine, things like H1N1 and other SARS, I think it's some other quarantines, suggests that in fact, we're very likely to see those stressors go up in the context of COVID. Next slide. So again, COVID's really likely to impact overall stress and therefore mental health and potentially substance use. At the same time that those issues are going up, it's likely to be decreasing the resources that children and families enjoy. So I know Dina has done a lot of wonderful work with the FACT platform, and we have her to thank for creating this network of many family resource centers around the county that in better times before COVID were open, where you could walk in the door, you could get free food, it was sitting right there, you could get childcare, you could go to classes, you could do Zumba, you could engage with your community and get resources. A lot of those are closed to foot traffic right now, and that's the right call from a safety perspective, but it means if you're a woman who's struggling with intimate partner violence, you don't have a space to go to away from your abuser, and your child doesn't have a space to go to away from their abuser, because statistically it's about 75% if a woman is being maltreated that the child is being physically abused as well. So I think the lack of safe spaces combined with the increased stressors is likely to lead to a lot of ACEs in our community right now, and I think it's on us, and particularly on me, to figure out how to protect those families who aren't getting out. So if any of you have ideas, please let me know after. I'd love to know more. Next slide, please. I want to quickly talk about the fact that, I guess I kind of mentioned this briefly before, but when we do get calls to our hotline, about 90% of the time people get free access to care, and only 2% of the time do we remove the child. Please click through. So one of the things that I worry about a lot when we talk about things like the referrals to our hotline going down by 50% is we no longer have that opportunity to catch people, right, when they're not yet in very dire straits. So again, of the calls we get in, 80%, there's no custody filed. We don't have any legal control over the family, but we offer them all these resources. They get signed up for Medi-Cal and CalFresh. They get access to some housing vouchers. They can get a lot of resources that they wouldn't otherwise have. And so I do worry a lot about a decrease in our ability to provide resources to people because we're not hearing about them when they're in minor trouble. What we're seeing now is many fewer cases, but much more severe injuries, particularly head trauma coming through. I believe that's the last slide. Will you just click through? Perfect. So I would love to talk more to you guys about all of these issues. I'm sure you have lots of questions and I'm thrilled to answer them. But first, I want to get you a little bit more information from my wonderful friend, Dr. Eric Ball. And I believe Dina Rubin already did a lot of his introductions, so I will just pass the mic. Take it away.
Thanks so much, Anne. That was great. I totally appreciate that. I'm hoping that I can build off what you discussed. And I think we're going to end this panel with a more optimistic tone. So I'm going to talk more about not just about ACEs, but ACEs screening and then what we do for children who have high ACEs scores. So next slide. So we're going to start out briefly, just kind of refreshing what you talked about 2 minutes ago. I'll talk a little bit about what we are screening for in California, and then how we work with families whose children have high ACEs scores. And then we're going to talk about how the lessons that we learned from kids with ACEs we could apply to the current COVID-19 pandemic. And that goes for both our patients and ourselves, so it's some self-care. Next. So this was the original ACEs study that Anne talked about. It was from 1998. It looked at actually a relatively well-off suburban population that had Kaiser Health Insurance in California, and showed that between 60 and 70% of the people in this study had at least one adverse childhood experience, and that there was a dose-dependent effect on health, and not just mental health, but also physical health. Next. Just to remind you, there are the 10 ACEs, adverse childhood experiences, that they looked at in the study. Next. And then in most studies that have happened subsequently, this is one, about 60 to 70% of people have at least one ACE, and in this study, over 16% had 4 or more. So out of the 130 or so people listening to this, a good 100 of us have at least one adverse childhood experience. Next. In California, a recent study showed that 63% of Californians had an ACE. And interestingly, there's a geographic distribution. And what surprised me was actually rural areas tend to have higher rates of adverse childhood experiences than urban areas, which was counterintuitive to me. Next. In Orange County, we're kind of on par with everybody else. So we're at about 61%. And then also about 10% or so that have a high number of ACEs. Next. And then again, this is the pyramid of how ACEs affects you that Anne talked about before, about how these adverse childhood experiences actually do physically change you and create this heightened level of fight or flight response that kind of goes on throughout your life. And if not mitigated or buffered, leads to not only mental health challenges down the road, but also physical health issues. Next. And again, it's a dose dependent fact. So if you look at the bottom right, that gigantic bubble, that's actually suicide attempts. So the more ACEs you have, the higher risk you are for all of these things. Next. And what I'm going to talk about is how if you identify ACEs early and intervene, you can cause significant reductions in the negative effects into adulthood. This is an image from the CDC, which suggests if ACEs went away, what would happen with society. And basically a lot of our chronic illnesses would decrease pretty dramatically. And this would be a huge, not only lifesaver, but also financial saver to our system. Next. So this is my residency class in Stanford. I'm not that old, but it's in black and white for some reason. And that is me. And that next is Nadine Burke-Harris, who was in my residency class. I spent 3 years basically living with Nadine. Next slide. So Nadine, after graduation, went on to be a primary care pediatrician in an underserved area of San Francisco and started noticing that kids she was dealing with were not responding to medical treatments the way she would have thought. So for example, children who had very bad asthma would not be responding very well to asthma medicines. And when she delved a little deeper, she started to realize that there was a lot of things going on in these families, and a lot of these children had suffered a lot of adverse childhood experiences. And when she started actually addressing that, the asthma got better. Last year or 2 years ago, she was named the first Surgeon General of California, and her main platform has been working on adverse childhood experiences, and with the goal of trying to cut them by 50% by the end of her term, or by a generation, sorry. Next. So she proposed and got approved to start a universal ACEs screening program for all of California, which went into effect January 1st of this year. Next. So here's what she is trying to do. So we're trying to start a primary prevention program by trying to have a public education campaign, part of why I'm here today, to talk about ACEs, to make sure that this is something that everybody knows about and that they're thinking about. We wanted to deploy broad scale screening, because you can't tell who has had ACEs in their childhood just by looking at them. And you have to kind of ask the questions to be able to identify who you need to help. We want to interrupt vertical transmission. So what we see a lot is that if you have a high ACEs score, you're much more likely that your children and subsequent generations will also have high ACEs scores. Next. And then we wanted to try to coordinate referral patterns, so increasing mental health coordination and trying to be able to get children and adults who need mental health and referrals where they need to go. And then they're also working on the science of toxic stress, which I'll talk about a little bit, trying to figure out like what exactly is all of these childhood experiences doing to you as a child on a biologic level, and are there things, medicines, et cetera, that we can potentially figure out down the road to mitigate those problems. Next. So here's what we're doing in California. So the budget last year put over $40 million into ACEs screenings, and they're basically just paying pediatricians $29 per screen to screen children every year for ACEs. And then over $50 million for education. So public service messages and educating providers about screening for ACEs and how to treat for them. Next. And just as an aside, the government, obviously the budget this year was hit pretty hard due to COVID-19, and basically the governor's May budget pretty much guts the the proposed ACEs moving forward for next year, cutting it pretty dramatically and almost cutting by 2/3 the amount for training. And so this is still up in the air. It hasn't been passed by the legislature yet, but I just want to point that out, that everything we're talking about might be moot because of the COVID-19 pandemic. And I'm happy to talk with people offline about this if they want to do more. Next. So part of the statewide process was we started a website called ACEs Aware, so acesaware.org. Pretty much everything I'm going to talk about after this is taken from the ACEs Aware website. It is an amazing website. It talks about how you can screen kids, but it also has a ton of resources about what to do to help mitigate the effects of adverse childhood experiences. It also has training where if you want to be learn about how to do this in your practice, there's great training on there as well. Next. So here's what we do for screening. So we use something called the PEARLS screening tool. This is a tool that just asks 10 questions. It's the same 10 questions that the initial ACEs study had. And you mark yes or no, basically with each one, you add them up and that's your ACEs score. And just like Dr. Light said, the higher the ACEs score, the more at risk you are for medical or mental health issues down the road. The PEARLS screen next also has an additional section on the bottom, which asks questions that were not in the original ACEs screen. So they're not validated. They haven't been looked at, but we're pretty sure they would affect you if you had these. For example, and this is pretty appropriate right now, it talks about if you've experienced discrimination over your life. So we would imagine that growing up in an environment where you are constantly discriminated against would have significant effects as a childhood experience. That actually hasn't been looked at like the other 10 have, but we assume that these, we take these into account when making referrals and conversations with families. Next. And here's a little algorithm of how we kind of deal with this. So you do your ACEs score, and then we look at your score, but we also take into account where you are with associated health conditions. So if you have an ACEs score of like 2 or 3, but you're like completely healthy, we actually don't do very much. We do some standard discussions with you. But if you have an ACEs score of 2 or 3 and you have a lot of high risk associated health conditions, so you have asthma or obesity or diabetes or what have you, we consider that a high risk or a positive screen, and we will do some other things that we'll talk about. We consider a score over 4 to be a positive screen. It automatically puts you in the higher risk area. Next. So what I'm going to talk about for the remainder of my talk is about how high ACEs scores are not destiny. Basically, if you have Dr. Light is a great example. If you have an ACEs score of 7, like you are not destined to have a terrible life and be depressed and have a lot of problems. It certainly increases your risk. But we found that there are buffering things that can be done both in the house and in the community that can really help you. There's been some recent studies out of Johns Hopkins, which have looked at what they're calling positive childhood experiences. So basically things that you could have in your life that will mitigate the effects of your adverse childhood experiences. And what they looked at are basically having essentially good relationships. So being able to talk to your family about your feelings, belonging, having a good sense of friends, having non-parent adults who took an interest in you. So having these buffering agents was certainly very helpful to kids. Next. Busy slide, but just to the gist of this is from this Johns Hopkins paper, showed that if you had between 4 and 8 ACEs, your risk of being diagnosed with major depression was 60%. But if you had 6 to 7 of those positive childhood experiences, it went down to 20%. So they were able to basically mitigate the adversity that you would feel from your other childhood experiences. Next. So when we talk about ACEs, the way we treat kids, we use a term called trauma-informed care. And trauma-informed care basically is a way it's a more holistic way to treat a child. And it talks basically about, not what's wrong with you, but what happened to you. Not like, oh, you have asthma, but like, let's talk about what may have influenced your asthma or why your asthma is so hard to treat. Next. And I'm going to talk a little bit about what we call toxic stress. So there's different kinds of stress that you can have. So positive stress is the everyday little stressors that we all have. It's good to have stress. If you have a charmed life and nothing ever bad happens to you, like that's not healthy either. So you need to have some adversity in your life to be able to get over and to learn some resiliency. There's tolerable stress. I consider the COVID-19 pandemic right now for me to be tolerable stress. So this totally sucks. It's affecting me greatly, but I have a loving family. I have a house, I have support, I have food on my table, I have a job. So I can get by. So it's a really stressful event, but I have buffers in place that allow me to maintain my mental and physical health. Then there's toxic stress. Toxic stress is a prolonged exposures to adversity without any buffering. So basically living in a house where there's domestic violence or chronic neglect. And the COVID-19 pandemic makes this even worse because now it's harder for you to get out of that environment. So the toxic stress gets even worse. Next. So you can click through all these. So basically the things that we look for with trauma-informed care is, number one is you have to have, as a provider, an understanding that these actually do impact health and behavior. And it's not obvious for most providers that if you had a harmful childhood that it could really affect the way that your diabetes care works. But we have to try to train people about that. You have to recognize that these effects do affect your health and your behavior. Our goal is to train providers, staff, leadership, and then to integrate this into everything that we do. Next. And so when we treat kids with increased risk of toxic stress, we, as pediatricians at least, talk about buffering agents, so ways that they can regulate their stress response. So remember, kids who have toxic stress basically have heightened rates of stress, of like flight or fight hormones, of cortisol, of adrenaline, but it's going crazy. They don't really have any way to bring those stress responses down, largely because they're lacking a lot of the buffering agents that many of us will use. So we talk about, and I'm going to talk about this a lot, we talk about this with these kids, that the 6, what Dr. Burke-Harris calls stress busters, are having supportive relationships, having high quality sleep, balanced nutrition, regular physical exercise, mindfulness and meditation, and if needed, mental health care. And we have shown that that having these factors in your life will help to buffer the bad effects, the toxic effects of some childhood adversity. Next. So let's shift gears a little bit and talk about how COVID-19 is affecting all of our mental health and how the lessons that we're learning from screening for ACEs can be applied for all of us currently. Next. So here's how we're feeling with mental health right now with COVID-19. So it started, and as many of you remember, when this first started, I think people in some ways had these emotional highs, that there were people like, outside of their windows clapping for the people going to work at hospitals. We had this sense of community, and you get this like heroic little section. And then you get this like plummet. And after a few weeks, it's like, oh my God, is this what our life's going to be like forever? This is terrible. I'm stuck in my house. I can't do the things I like to do. And I think we're somewhere down the bottom of that little valley right now. And what's happening now is people are just kind of giving up, and they're trying to, they're doing unsafe things because of that. And so all of us are going through this mental health roller coaster right now. And for those of us who don't have a lot of adversity and have a lot of buffering, it's horrible, but it's manageable. But if you have a tough childhood, if you have a high level of ACEs, it makes it even more difficult. Next. So this is a slide that we're seeing in our office. These are the vaccination rates in pediatricians' offices over the past month. And what you see is there's a precipitous decline. And I put this up here to go along with what Dr. Light was saying about how those of us who it's our job to screen for ACEs and to look out for kids who are suffering maltreatment, we're kind of out of the game right now. So we're not seeing as many patients in our offices anymore because kids are scared, our parents are scared to go out of the house. And so those of us who are on the front lines to identify this are sidelined for the most part. Next. So it's also hurting us as doctors. So there's been suicides of physicians who are kind of overwhelmed by the whole situation. And then much like everyone else, I mean, I own a small business, and we are having a hard time from an economic standpoint as well. Next. So I like this phrase, and this is about self-care. So as a doctor at a cardiac arrest, the first procedure is to take your own pulse. So in other words, you're no use to your patients or your clients if you are a mess, right? So the first role of anybody in a crisis, in a pandemic, is self-care, get your own house in order, take care of yourself, and then you can go on and take care of others. Next. So the Surgeon General put out this playbook, which I highly recommend. You can get it from ACEs Aware as well, which talks about stress busters. It's for everybody, but I like to use it as a provider. Next. And here are the stress busters that she talks about. And you can see they're exactly the same thing that we talk about as buffering things that people who have high ACEs scores can use. Next. So I'm going to go through these really quickly. So number one is having supportive relationships. So it's very critical at this time to, make sure that you are having a good relationship with the people who are quarantined with you, and reaching out maybe to other people who are not with you, and trying to maybe rekindle old relationships as well. Exercise is huge. I give this talk to every single kid that I see in my office now. So our goal is at least 60 minutes of physical activity. It makes a huge difference. And then getting good sleep. So sleep is tough right now. A lot of us, our schedules are off and we're stressed out. And so getting adequate sleep is super important right now, probably more than ever. Next. Nutrition, obviously always important, but even now it's somewhat harder because some things are a little in short supply, but making sure your nutrition is good. Next. Mental and behavioral health support is huge. I've referred more kids to mental health providers over the past few months than I had in the past few years. And so we're really trying to get kids help when they need it. And then mindfulness and meditation, just kind of taking some minutes out of your day and kind of just relaxing and, taking a deep breath. In my office, we meditate for 10 minutes every day after lunch. It's really helpful to recharge for the afternoon. We use the Calm app, but there's lots of other ways to do it. So let's talk a little bit about what we're doing with everybody during our pandemic. Next. So here are the barriers that make screening harder and that make ACEs exacerbated during the COVID-19 pandemic. So number one is that we've decreased the amount of ACEs screening that we can do because we're just seeing fewer kids because kids are told to stay at home. There's kids out there, like my kids, for example, who have very low ACEs scores, and this is the most traumatic experience of their life. Like, they haven't actually developed a lot of these buffering systems because they haven't needed to in the past. And so I am kind of talking about this with all of my patients from like that. This is a spiel I give to every patient who comes in my office who's school age or more now. I go over those 6 stress busters, no matter what their past was, no matter what their ACEs score was. I think it's important at this point. As we've talked about, if you're already experiencing traumatic experiences, this is greatly amplifying them and making things worse. Next. We're suffering with the issue of children are now often separated from their trusted adult relationships. So especially if you're in an unstable household or you don't have a good relationship with your family, a lot of those kids really rely on coaches or spiritual leaders or teachers, and they can't see these people anymore. So as we talked about in the past, having a good relationship with a trusted adult is often an extremely important buffering. So we're seeing lots of fear and uncertainty in society right now. Kids really thrive on structure and predictability, and that's really out the door, and that makes things a lot harder for all of us. Next. And then a lot of these stress busting activities that we talked about are a little more difficult to do now, right? So it's hard to have a supportive relationship if you can't see anybody. It's hard to exercise, gyms are closed, you're not supposed to walk without a mask, things like that. Sleep has been tough, disrupted schedules. I have kids who are going to bed at 2 in the morning and waking up at noon. I don't know about you guys. I'm actually having COVID dreams where I will like just think about this stuff in the middle of the night and I wake up a lot, and it's never happened to me before. Nutrition is a little harder because you don't want to go to the store, and so it's easier just to buy a lot of packaged goods and instead of fresh fruits and vegetables. And then mental health is harder to get now because a lot of practices are closed or are just doing their visits over Zoom, which is great, but maybe it's not the same as being in your therapist's office. Next. So here are some things you can do. So number one is, reach out to people. So especially if you're in one of our professions, we are reaching out to our medically high risk population. So our kids who have ADHD or asthma, we're calling them proactively. It's how are you doing? Are you adjusting okay? Do you have your medicines okay? So reach out to those people and kind of check on them. We're also doing this with kids who have high ACEs scores. So kids who you worry about on a normal day-to-day basis. And so we are not waiting for them to call us, we're calling them. We're doing a lot of telehealth now in our office to keep kids at home. And telehealth's actually interesting because you not only can help take care of someone, but you actually see their house and you see what's going on, and that actually informs you. So a family who tells you everything is great, then you go on your telehealth visit about something and you see there's like, 20 kids running around, and you can get a glimpse into their life, very different than if they're in your office. Next. And then there's not a lot of positives to the situation, but you really should emphasize them with your families. So, this is a good time you see more of your family. So if you like your family, it's a really great. I'm doing walking. We're going on walks with my family every day. We're playing board games. We're doing all this stuff that I wish we would have done in the past, and we don't. We're making more connections with old relationships. We are and seeing some community cohesion, especially in my pediatric community. There's a lot of people working together now, which has been really great. It's good to work with families on resiliency. Again, I talk about these 6 buffering strategies all the time, all day long. Next. It's good to be a supportive adult for someone. So, reach out to people. There's always people in your neighborhood who maybe are higher risk and don't want to go shopping, go shopping for them. So it's a really good time to be a good neighbor and a good community member. And then again, like I did with my kids, we're using this pandemic as an opportunity to discuss resiliency for everybody. So I hope actually the buffering lessons that my kids learned during this pandemic will help them when they have like a hard test in college or when they're parents. So I think the mindfulness, the sleep, the exercise, and what have you that we're learning now will be beneficial down the road. Next. And so what I think hopefully got out of this in the past 20 minutes is, though everything is totally different right now, but the strategies that we use to relieve our stress, to decrease the risk of toxic stress, to help mitigate adverse childhood experiences are the same. And that goes for whether you have a high ACE score or you living in the middle of a pandemic. And finally, I want to end you with my stress busters. Next. That's Twinkle and Everly. And I'd recommend that if you're ever really stressed out, you just get a Cavalier King Charles on your lap and it all melts away. Thank you so much. Thanks for the organizers for inviting us. And I think we're going to go to a brief question and answer period.
Thank you. Thank you both, Eric and Anne, for those incredibly informative presentations. It looks like we'll have time for about 2 questions, and any unanswered questions we'll be posting to our website. So we did receive a question prior to the summit that I'm hoping we could take some time to answer. And this question actually relates to something that Anne brought up about the child reports being reduced since COVID, and perhaps you both would like to touch on this question. With children not being in school and other usual activities outside of the home, do you foresee the incidence of child abuse during the stay-at-home orders will have a delayed influence on child reports and the need for interventions once these activities resume? And how do we prepare for this?
This is a really great question. It's something I think about a lot. Yeah, I think there probably are a lot of families right now who are struggling that we're not hearing about. And particularly, I think those families who are really struggling with mental illness, with substance abuse, and again, 80% of what we see in our county is neglect. So I think when children are having head injuries and broken bones, we know about it because they end up in the hospital. But I think those families where parents are really struggling with substance abuse may be going under the radar now. And so I do anticipate that as we open up resources and as parents and kids get back into the community, we probably will see an increase in reporting because we'll start to know more about those homes that are really struggling. And I think the challenge from our end is, given that budgets are tightening, I know at social services, we do not only child abuse, but we do all welfare to work, we do all food subsidies, we do Medi-Cal, and all of those needs are rising at the same time that our budget, which is based on sales tax, is shrinking. So how are we going to make sure that we are preserving our networks of workers to respond when those calls come in? It's Hard, but important.
Yeah, thank you. Eric, is there anything else you'd like to add?
I'm dreading the after effects of this. I
Yeah.
think both from a mental health perspective, but also a physical health perspective. And not only are we not seeing families and filing CPS reports if necessary and doing our ACEs screening, but also people aren't getting their mammograms and they're not going to the dentist when they need to. And I'm definitely worried about what is going to come out on the other side of this. And we're, as Ann said, it's tough. And I think, again, I'll mention this again, the governor's new budget has pretty substantial cuts to social services and health services when we're going to need them the most. And so it's important that people let their that these are vital services that we're going to need more than ever. As more people go on to Medicaid, as more people need these services, we're cutting their budgets, and that's really, really worrisome to me.
Do either of you have any thoughts about how as a community we could be more proactive instead of reactive around how we can build resilience and respond to trauma?
One of the things we talk about in with ACEs Aware is right now the focus has been a lot on doctors, on pediatricians. So we're the pediatricians, we're doing these ACEs screenings right now. And I think the goal is eventually to really get this out more towards to educators and other community members who frankly see kids way more than we do and try to make this well known. When we started this project, even just a year ago, very few physicians knew what this even was. They don't teach it in medical. I mean, they might now, but it's not very well discussed. And so just getting the word out that that these experiences that children are having really does affect them. And then trying to talk to our legislators and policymakers about how this is a huge cost savings down the road. I mean, if you can cut kids having, becoming adults who have depression or diabetes, and you can cut these rates, it's gonna save our society. And this is, I'll leave you with this. Dr. Brooke Harris talks about how this is almost equivalent to the germ theory of medicine back in the day. So people used to get sick all the time. We had no idea why they'd get sick. They would just get sick and die. And they made up all these maybe it's the ether, maybe it's the wind, whatever. And then they came out and they're like, oh my God, there are these things called germs, which you catch them and you get sick and you die. And if we can stop or treat the germs, that's how we can fix you. And that was this light bulb of, wow, so we can help with acute illnesses. And this is almost like the germ theory of chronic illnesses. So right now we're very reactive. Somebody gets diabetes, we treat them. Someone gets asthma, we treat them. Someone gets depression, we treat them. But this is really, to a large extent, the core of this is why they get diabetes or why they develop depression. And so it's almost like the germ theory of chronic diseases. And chronic diseases take up so much of our healthcare budget that if we can spread the gospel and get this word out, it would be amazing down the road.
Great.
Yeah, I agree. I mean, I'd love to see more discussion about building resiliency. I think the more we can advocate for folks, particularly in our healthcare agency and with our schools now, do a lot of great work around resiliency and mental health. And they're doing some of that online as schools are out of session. But I think that the more that we can really drive home that that's an important way to prevent future issues, the better we're going to be able to preserve those services now in budget cuts. But I think that's going to be really critical towards the after effects and what things look like on the back end.
Thank you. And I think we have time for one last question. And this question is from Beth England Mackey. How are you able to get parents to agree to having their children screened when often abuse is a secret and families don't want others to know?
So from my view, we do what's called a de-identified screen. So basically we give them the 10 ACEs questions and we say, in your brain, which ones are yes, and then just write a number on the bottom. So we actually don't ask them as pediatricians what the yeses were. So if your ACEs score is 4, we don't know which 4 of those 10 are positive. And we do that because, I mean, I'm not a therapist. I'm not an expert in this stuff. I'm not a child abuse pediatrician. And so it's my job mainly to identify who is at higher risk and then how to refer them to services they need rather than to go down a rabbit hole of abuse at that well child check. Now that's the job of the therapist who they'll see to kind of delve deeper and kind of figure out what's going on. But you'd be amazed. I mean, it's like we regularly get pretty high ACEs scores, and I've had very few patients worry about it. And I think if you explain it to families really well, that like, look, we're seeing some of these things make your child a little bit higher risk for certain issues down the road. And if we identify them and things we can do to make that a little bit less likely, parents are really, really encouraged by that.
Have you seen any differences culturally with certain families around that?
I don't think so. I haven't. I think it all depends on how you frame the questionnaire when you give it to them. And we try to do it in a very positive, we're trying to help your child way, not we're accusing you of, being a neglectful parent kind of way.
Thanks. Anne, anything you'd like to add before we close?
No, just thank you for having me. And I'm so glad that, you guys are really spearheading this discussion, because I think things like ACEs are not as widely discussed as people focus on COVID, and yet they're the kind of things that are so important to long-term health of our society and are very likely to increase now at the same time we're having a decrease in resources. So thank you so much for highlighting this really critical public health issue as it relates to what we're going through right now.
Well, thank you both. And I think that there definitely need to be discussed as we discuss women's health and how do we advance women's health. And I really want to thank you both for all you're doing in Orange County to advance the health and well-being of children. So now I'm going to invite my colleague, Allison Sonnenschein, to take over the meeting and close out today's summit. Thank you both. Oops, I'm on.
Just want to start by thanking Dr. Light and Dr. Ball again for those incredible insights into ACEs, average childhood experiences, and how they impact health outcomes over the long term, and the interplay between COVID-19 and ACEs, the science of ACEs, as well as the implementation of ACEs screening and referrals. So thank you so much. That was incredibly enlightening. Just to quickly try and tie everything together, I think the key takeaway is that what we heard today from Congressman Ruda's federal update to Judy Belk's keynote and now the panel discussion on ACEs is really how a pandemic, a crisis like COVID-19 can very profoundly illuminate how factors such as social determinants of health, ACEs, and gender are so interrelated and can lead to very different outcomes. And this is so obvious, so evident. We've talked a lot about the inequities, but what drives these inequities are the factors that we talked about today. With ACEs, we've seen how abuse and neglect and household dysfunction literally change your brain's biology and disrupt your neurodevelopment, which can lead to ACEs-associated health conditions like depression, cancer, and a lower life expectancy if not addressed early in life. We also heard about how race, place, immigrant status, and of course, poverty as social determinants of health can produce very inequitable and disparate health outcomes for different communities. Gender, of course, overlays all of this. Women are more likely, we heard, to experience certain types of ACEs, and certain ACEs-associated health conditions can be exacerbated by gender and other social determinants of health. With COVID-19, as we heard at the beginning of today's session, women are bearing the brunt of the job loss. Women are taking on the increased risk of working in the essential frontline workforce. Women are losing not only their jobs, but also their health insurance while they're taking on additional childcare and caregiving responsibilities. And so although we see that men are bearing the disproportionate share of cases and deaths from COVID, We can probably predict at this point that it will be women over the long term, as well as communities of color, men and women, who are going to be bearing the long-term effects and fallout on the economy and long-term health outcomes related to COVID-19. Fortunately, as with ACEs, I would like to suggest that the same stress busters that Dr. Ball just reviewed with us and some of the strategies how to deliver trauma-informed care during a pandemic like COVID-19 are equally applicable across the board, whether it's a pandemic or any other type of stressful situation, that we should be taking advantage of some of these strategies and making sure that these buffers are in place for all of our families in Orange County. And this, of course, has to be part of the call to action. We've heard from Judy Belk what some of the policy opportunities are moving forward as we think about rebuilding. Reviving or elevating the discussion about universal health care and delinking health insurance from jobs, addressing income inequality, looking at how we can overcome the relationship between race and life expectancy, the disparities in life expectancy, the digital divide, and creating what she termed as a new social impact with government. We have to be advocating for all of these things, as well as preserving the importance of ACEs screening and early intervention and referrals, so that we can avoid not just the long-term consequences of COVID, but of the underlying ACEs that contribute to and can really shape the trajectory of an individual's health. So I want to thank all of our speakers and all of you for joining us today, and remind you at the end to please complete the evaluation. Remember to request your CEUs, and join us next Wednesday on June 3rd while we explore how COVID-19 is affecting sexual health here in Orange County. Thank you so much for your attention today. We look forward to seeing you next week. Thank you to the team, our advisory board, our sponsors, and all of you, our participants. Have a wonderful day. Thank you.